How does this change my daily routine? The basics. The virus is transmitted via respiratory droplets from an infected person. It can be transmitted by sneezing, talking, or coughing. It is important to wash your hands often with soap and water for at least 20 seconds. Use hand sanitizer that contains at least 60% alcohol. Avoid touching your nose, eyes, and mouth. To prevent the spread of germs, avoid touching your eyes, nose, and mouth. Wear cloth face coverings. Cover your cough or sneeze with a tissue. Throw the tissue in the trash and wash your hands thoroughly. Discontinue toothbrushing in childcare facilities. Exclude individuals from your center if they have experienced symptoms of a respiratory illness in the last 14 days. How does this change my daily routine? Updated practices for childcare programs. Arrival and departure procedures. Stagger drop-off and pickup times. Arrival and departure procedures. Take temperatures and check children and staff for symptoms upon entry each day. Ask if medications were used to lower a child's temperature and if there are any household members with COVID-19. Meals. Eliminate family-style meals. Have employees, not children, handle utensils and serve food to reduce the spread of germs. Through the day, adults and children over 3 should wear multi-layer face coverings that fully cover the mouth and nose. Incorporate physical distancing within groups, at least 6 feet between children. How does this change my daily routine? Communication. Adults can help children cope with the impact of COVID-19 related changes by remaining calm and reassuring. Avoid language that might blame others and lead to stigma. Your program can support staff and family members in understanding policy changes related to COVID-19 by posting signs that remind staff and families of expectations related to hand hygiene, respiratory etiquette, and how to monitor themselves for signs and symptoms of the illness. It is very important to add the components of your plan that address infectious disease outbreaks to your emergency preparedness plan. Document any changes to your operations as a result of COVID-19. Maintain evidence to support why the changes were made, and share the information with licensing staff. How does this change my daily routine? Protecting communities. Guidance for reopening. In this section, we went over steps to take if a child, parent, or staff member develops COVID-19 or symptoms. Cleaning and disinfecting services if you have a person who is sick at your facility. Recommendations for cleaning staff if you have a person who is sick at your facility. Facilities with a confirmed case of COVID-19 will be closed. The center should immediately air out the facility for 24 hours and then follow the guidance in this training and from the most updated information on the CDC and DOH websites. The duration of the closure will depend on multiple factors, including the most up-to-date information about COVID-19 and the specific cases in the impacted community. When cleaning and disinfecting the facility after a person at the facility is sick, your staff should ensure cleaning staff wear disposable gloves and gowns for all tasks in the cleaning process, including handling trash. The proper way to prepare the bleach solution when cleaning and disinfecting surfaces if you have a person who is sick at your facility. Ensure cleaning staff use 5 tablespoons or 1/3 cup of bleach per gallon of water, or use 4 teaspoons of bleach per quart of water.